and justice for all. Would like to welcome everybody to today's August 24th, 2023 Branch Hillsdale St. Joseph Board of Health meeting. If our lovely Teresa Fisher will call the roll.
Commissioner Matthew.
Here.
Commissioner Hoffmeister.
Here.
Commissioner Houts.
Here.
Commissioner Leininger.
Here.
Commissioner Baker.
Yep.
Commissioner Lanius.
Here.
Thank you.
We have all 6 members of the Board of Health present. Item 1C, approval of the agenda.
Make a motion, we approve the agenda as presented.
Support.
We have a motion by Commissioner Hoffmeister, second by Commissioner Lanius to approve the agenda as presented. Any discussion? Hearing none, all those in favor say aye.
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 All those opposed, motion carries. Approval of the minutes of the July 27th, 2023 Board of Health meeting, and those are in our packet, pages 3 and 4.
I move to approve, put them on file.
I second, Mr. Chairman.
We have a motion by Commissioner Houts, second by Commissioner Matthew to approve the minutes of the July 27th, 2023 Board of Health meeting as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Is that time of our meeting where we open up the podium for the public to address the Board of Health. We have rules for our public comment on our agenda, and we have no public.
Anybody online?
No online and no written comments. So we will move right ahead with the health officer's report.
Good morning.
Good morning.
So the first thing I want to ask before I jump into my written report is that next month during my evaluation, if we could do closed session, I would appreciate that. So I want to formally make that request. Moving on to the written report. Today we will have a presentation about essential local public health services. This really isn't anything you probably haven't heard us talk about all year. But we'll do a little bit of a dive into what those programs are and the funding behind each. Wanted to let you know that with regards to our strategic plan, that the Workplace Satisfaction Group met, reviewed the annual employee satisfaction survey. I believe you guys might have that now too. Oh, almost will. They did make a couple of recommendations to increase communication with the entire health department team. So we'll work on implementing those. The Community Health Needs Assessment, Community Health Improvement Plan, one of the recommendations for that was to investigate a syringe service program, or otherwise known as a harm reduction program. There's a lot of interest in doing a syringe exchange program out of Pines Behavioral here in Branch County. They wanted to meet with us. Callie and I did talk with them, and Callie's just doing some research at this point about what something like that would look like, how we would implement such a program. No decision on if we're going to move in that direction at all. Just wanted to let you know that we are working on some of the things that were outlined in our Community Health Improvement Plan. Okay. The Personnel Policy Committee has been meeting, as I've reported in previous months, and there is a document today for you to review, and we're looking for approval on that. The EH software implementation go live happened last week, and it was certainly, like all new things, there will be a period of adjustment, but they're working hard at it, and real pleased with how that all rolled out. The Hillsdale Hospital proposal, we did put in place an agreement with the hospital for use of the mobile van 2 days a week. So that document is in place, and now we are just waiting for the hospital to finish some of their final planning items that they need to do to make that unit qualify as a rural health mobile clinic. I'm not saying that right. but essentially, that is what they're trying to do at this point, is to make sure that it meets the requirements for that. So I wanted to outline a few public health concerns that we're working on. The City of Three Rivers had an action level exceedance for lead, and that resulted from routine drinking water, municipal water supply testing. The lead and copper levels have gone lower in recent months in the state with enactment of new rules, so we weren't necessarily surprised that this popped up.
The threshold for exceedance
Exceedance.
reduced, not the,
Overall levels.
I mean, did the actual level of lead in the water go up there, or was it just because of the
They changed the
decrease?
testing standard.
They changed the testing standard, but they also, as a part of that, the municipality is required to look harder for it. So if you know you have lead service lines, you have to sample those now. And they may not have been part of the original sampling plan. They may have, but they also may not have been. So they're required now to sample those supplies where they're likely to get a higher result. So this will start happening with all municipal water supplies, especially those that don't have treatment. So there's no corrosion control treatment in the City of Three Rivers water supply, so nothing there to help minimize lead flaking off into the drinking water supply if you have a lead service line.
Hopefully, with this change and with this being flagged, maybe the city will be able to get some grants to take care of, more resources to help take care of the infrastructure in Three Rivers.
You're in St. Joe County?
Yeah, hopefully.
And it's everywhere. Every municipality is gonna face this. There's lead service lines all over the place. They just are. It has to do when, houses were put in and when municipal water was installed, and so, this is gonna be happening over and over and over again.
So what are we doing to mitigate this?
So at this point, we are part of the filter distribution program. So we are messaging to the public that, especially if you have children in the house or children that visit your home, if you know you have a lead service line, you definitely need to take action. If you're not sure, try to see if you can't figure that out with the City of Three Rivers. So lots of messaging and then filter distribution. So if you're gonna run water, make sure it goes through a filter and that's what you consume or cook with.
And that's readily available for anybody in the city?
They're available for everyone. There is, those are supplied by MDHHS and they're need-based. So if you are on Medicaid or WIC, you automatically qualify. But what they're doing when somebody comes to us, they're doing a questionnaire, and if somebody says, I can't afford to buy one right now, they don't have to show any paperwork that they would qualify for Medicaid or qualify for WIC or something like that. They just have to declare that they have need.
Right.
So
Okay.
basically,
Well, it's empty, I can't afford to buy one right now. So.
right,
Well, I'm just trying to these people are forced to have city water. You can't drop a well in your backyard, and
right.
we should be taking care of them if we don't let, other options, and as long as we're doing that.
And they are. I mean, I know multiple people have gone to the health department, and the health department's been very generous in handing out filters. I don't think anybody's been turned away, so,
We haven't turned anybody away, to
Yeah.
my knowledge.
yeah.
So are these whole house filters or just for the drinking water?
Point of use.
Point
So,
of use.
and there's actually two filters. One attaches to your kitchen faucet if you have an aerator. If you have one of those spray faucets, then you get a Brita pitcher filter. So you get the filtering device and a couple of extra filters. And then because they collect your information, you'll be on a list that we will, the state will reach back out and say, do you need more supplies? This is where to get additional filters, things like that.
So it's cartridge replacements. So the filter will remain the same, but there'll be cartridge filter replacements. Much as what we do with our PFAS folks that have been supplied with, and those filters are a little different. Those are under counter. It doesn't attach right to the faucet. It's under counter. So they have a spigot that runs out to give them the filtered water, and we also supply them with cartridge replacements. So the cartridges are typically good for 6 months. So every year, we've been distributing 2 sets of filters, so they have a year's worth. And then we contact people every year, tell them, hey, they're here, come pick them up. So.
Some of the other locations that we've distributed them have been at the school open houses at Andrews and Hopkins. So those 2 schools are elementary and they are in town. So they tend to serve children that are families that are in town. And also at the Huss Back to School event that was a couple of weeks ago now. So not only at our office, but we've also been out to distribute.
Very good.
Commissioner Matthews.
Thank you. I have a question to Health Officer Ms. Burns, as well as to our Director of Environmental, Mr. Andriachi. Are you working with the City of Three Rivers leadership? Because it can be a long-term issue, and we don't want to end up holding our responsibility and blaming us rather.
We are
Yes.
working with the city.
Yeah, and we've been having meetings with leadership at the city, and I think it's been a really good working relationship between us, and also, of course, MDHHS has been involved with this too. So MDHHS has been sending folks to help with the filter distribution. So they're distributing filters at the city and at the health department, and the city's been very cooperative. You know, they get the supply of filters, and when we get low, they send someone over or give us some more filters, and so there's constant communication that's been going on between us and the city and MDHHS.
But our role is limited in this, you know.
Right, yeah, we
Yes,
we have no enforcement role whatsoever in this. We're just trying to educate people and help with supplying the filters for folks, make sure that they have filters if they need them.
And let's be honest, probably if those testing standards had not been lowered below the federal testing standards that Michigan did, this probably wouldn't be an issue now.
Most
Very
likely.
likely.
Most likely, that's correct, yes.
That and the fact that they're being forced to look at supplies with known lead service lines. You're gonna find it if you are sampling from known lead service lines, so. Yep. All right, algal blooms. So it's that time of the year that it's not uncommon for lakes to develop those algal blooms. The water's warmer. When it's calm and there's excess nutrients that build up, we see these happen. Cyanobacteria cause algal blooms and can produce cyanotoxins. So we've had a few reports of lakes in Hillsdale County where people are seeing this pea soup on the water. Lake Diane, for example, the state did come down and take samples, and Paul just got the results today that they did not find the cyanotoxins in the samples they collected, but there's no doubt that there was an algal bloom.
Right.
It just hadn't produced toxins. And then Riebeck Lake is the other
Yeah.
one that came up yesterday. It's
It's
R-I-
R-E-B-E-C-K. I've
That
never
was
heard of that
R-I.
lake before, but there was a report of possible algal bloom on that lake, and so Eagle let us know that they were gonna be sending somebody out to confirm that. I have not heard back yet, so I don't know if it actually did have an algal bloom, and if it was, then I'm sure the state will be testing that one as well to make sure that there's not any toxins, but
I didn't feel so.
that's all we know
Is-
at this point, is that there's a
Where's
suspected.
Chris? Yeah, where's Chris the clerk?
I
Is
looked it up on the
Camden?
map, it's north of Montgomery.
Yeah, it's pretty close to where Chris Dewey lives.
You hear anything on Marble Lake?
I haven't.
No,
I've had a friend who complains about the pea soup this time of year, but must be no one's ever called it in.
I've not gotten any information on that lake, no.
Sometimes people will call the state directly and then the state notifies us. That might be how we found
That's
out
how,
about
yeah,
Riebeck.
that's how we found out about it,
Um,
yeah.
But
Yeah,
so
there's-
there's no, public access at Ryebeck Lake, but there is kind of an informal homeowners association or lake association there, as
What-
far as we can tell.
What does this do now? I saw that you said it can make people and animals sick, but what ultimately?
Yeah, so these cyanotoxins, and it's been in the news a lot lately as well, you don't wanna drink them. They can cause rashes on your skin if you're exposed that way, but now there's even concerns about them being aerosolized. But that is new, that's new concerns, although probably very, very likely that it's something to be thinking about. So yeah, if you've got pets that get in it, you know, wash your pet, try to stay out of it, don't get in it yourself.
Yeah.
Try to stay away from it, don't bolt through it,
Yeah.
right?
When was that first reported over there in Lake Diane, Paul?
The date of the first report,
You know,
if you give me a minute, I can look that up, I'm not sure off the top of my head.
okay.
I did give you the phone number there to report, and also the email address that algal blooms can be reported to. We issued an advisory about Lake Diane on August 18th, the press release. It was picked up by media, and it is now on our website. It was not until yesterday. So while you're looking, I'm gonna keep going. With regards to COVID, the public health emergency, I'm sorry. Oh, I'm so sorry.
I wonder how long does this, algae bloom usually last before you can pull any warnings away? Is it gonna go on?
It needs to cool down, temperatures need to cool down, kill it off, pretty much.
Okay, so
I
water
mean-
temperatures have to
Yep,
cool off.
yep. Warm temperatures, the nutrients aren't going away, right?
Right,
And
right.
that's what they need, so
That's what I wondered, is how long it lasts.
Well, those lakes will turn over twice a year.
they do.
Is that the same time?
August 16th.
No.
It's a temperature thing, so the lower level of the lake is colder than the top. And so as the temperatures, get to that point where they're close, it will invert. And, that's what you're talking about, twice a year usually, in the spring and in the fall, winter.
Thank you.
All right, moving on to COVID. Of course, the public health emergency has ended, but cases of COVID are still around. We're actually hearing about a few now that, I don't know why this time of the year we have to hear about them, but we do. With school restarting, temperatures cooling down, people are gonna be inside, more chance for spread of the disease. There are still resources in Michigan for free testing and vaccination at this time. So, there's a library program where some libraries that choose to participate, can have, testing supplies that are available to hand out. The Branch County Library System is just coming online. We, have been working with them, and I'm really glad to be able to report that they are going to be coming online. And then we have some libraries in both of the other two counties that also provide these testing supplies. These are the antigen tests. We do still have the kiosks in Three Rivers and at Goodwill here, and in Sturgis, and those are also available to the public. So that's available, and then vaccines are currently still available at no cost, but we are no longer able to order the COVID vaccine through the federal government. That has ended. And so we're waiting at this time for the transition from the free, federally supplied vaccine to the stuff that we'll have to source through the companies that make it. We've got enough right now for a little while, so nothing that we have to order at this time. But there is certainly a transition and going on.
Is it, effective on the new strains?
To an extent.
To an extent, that's a great question. I don't know that that's been proven completely yet.
Yeah.
Michigan's a little behind with our numbers, like everywhere else, the numbers are creeping up, you know, we're starting to creep up, but I'm guessing we will as well, so
It's out there.
it's out there.
Therapeutics are still available, so for those individuals who do get COVID and, they have some risk factors, therapeutics are available, you get those through your provider. So I wanted to point that out. And really, how you handle a case of COVID is really the same. So if you do come down with COVID, the best thing to do is to isolate away from others to try to keep it from spreading. And then after 5 days and you're fever-free, you can come out of that isolation.
The numbers that we're seeing, I'm sorry, the numbers that we're seeing is the, it's probably too early to tell, but is the fatality a concern, or is it essentially just the infection rate?
It seems to be less, the fatality rate, but the infection rate's going up in the rest of the nation, so, and I think a lot of people are prescribing therapeutics, so that's been helpful, and people know to go get them and, stay isolated, so I think that's helping fatality rates. Yeah, hospitalizations are a little less than we were in the height of things, and then fatalities are less as well, so.
Okay, good.
At least it's good. The new strains are gonna be worrisome too, so.
Don't really have anything new to report with regards to opioid settlement funds. We have been sending additional information to Hillsdale County, and we'll continue to do so as long as they ask for it. We had asked for a small bit of the opioid settlement funds from each of the counties, and Hillsdale County is the one that's been engaging with us at this time.
And just an update on that, we have another committee meeting on the 13th.
Okay. If you need us there, just let us know.
We'll be discussing a lot of that at the commissioner meeting later.
Okay. So what I asked for was $10,000 from each county, so it's not a lot. And it's my hope that we wouldn't just get it from one county, we'd get it from all three, because we wanna do an educational effort that we can do in all three counties, not just focused on the county that chooses to give us some funding.
That's a one-time deal.
No, nothing from St. Joe. That's all we asked for at this time, was 10,000 from each county. We can always come back and ask again if it turns out to be
You sit down
positive.
with Laura, we can
Talk
talk
about
about
that as
that
well.
too, yeah.
Okay, I did send the email.
As we move
Well,
forward.
for Branch County and St. Joe County with your administrator, I know they both reached out to our chairman of our board, and we're kind of waiting to see what we did before they made the recommendation.
Well, that's kinda what I thought Teresa was sitting on, waiting to see what everybody else was gonna do.
And then, we got a big thing with the sheriff's part right now, and how much money we're gonna, and how we're gonna fund deputies, so, and that's in the discussion, so, and that's today's topic, so,
Yeah, you guys are gonna go 24 hour again, aren't you?
we're trying to get there again.
All right, as far as building updates, nothing new for Coldwater or Hillsdale to report. At Sturgis, we are really, really close to being done with the contractor work there. Teresa and I have been over there a couple of times to look it over, make plans for ordering some desks and chairs that we need to put in that space for our staff, and I believe we'll have occupancy by the 1st of September in the entire space. Three Rivers, I sent you some pictures. So actually the end here on the parking lot that was still brown is now white. They have pretty much wrapped up that project and it looks really good, so. And then just to note that I'll be heading back up to the UP for some work up there, and I'll be back next week. That's what I have for you today.
Okay, any other questions for Health Officer Burns?
Sure. Mr. Chairman?
Commissioner Smith?
The health officer requested for next meeting closed session.
Yes.
Are we ready?
We'll do the evaluation, yeah, after our meeting today, in the next couple of weeks. We can talk about that further on underneath the new business, where we have that evaluation policy. Yes.
Rebecca, have you heard anything about a new variance coming through? Because right now there's University of Georgia that's gone totally masked, and now there's places in California showing up with requirement mask requirements. Have you heard anything at all, coming down that direction?
I don't think we're gonna go back that way here in Michigan unless things get really, really, really bad. That's my gut feeling. What do you think, Dr. LeBron?
I agree.
Yeah. I just don't see that happening again.
I just threw all mine away, so we're good.
I never had any.
Yeah.
You're the reason why it's coming back, you just
Well,
threw
I
your mask away?
cleaned my truck out the other day.
Well,
and there was
again,
some in
we could discuss why cases rise right now.
there. Yeah.
And I could give you multiple reasons why I think cases are on the rise right now, so.
I hope not.
Any other questions for? All right, if not, we will move on to the medical director's report. Dr. Luparello.
Good morning.
Good morning.
I also think, being kind of driven by data is a nice thing, and the data is so ridiculous with COVID right now, right? How many people are taking home tests, not saying if they were positive or negative, and, it's just an interesting dynamic, because we should be data-driven in our decision-making, and the data is just not gonna be good. I mean, I've known people personally who, I'm pretty sure they have COVID, and they're at work, and, go home, oh, I tested twice, I was negative, like,
Yeah.
did you or did you not, pretty sure you have COVID, go home. So, yeah, I hate those kind of decisions, masking, and I just, those decisions are really hard without good data. So I think we're gonna be right back where we started, and you can look around Michigan, and there are still counties where people are getting sued for recommending masks, and, there's a lot going on, so I hope we don't have to, I hope we don't have to go there. I'd really like to not go there. If you go to some big cities, it's amazing how many people are still walking around with masks on. The airports, I don't know if those are immunocompromised people or people that are just kind of making decisions to wear masks. And I think that's okay, right? That they're allowed to wear a mask, and some of us don't have to wear a mask, or you can make that personal choice. So I think that's a good thing.
Right. Important thing there, personal choice.
Yes, I like the personal choice.
I saw a guy with a mask on riding a motorcycle by himself.
No, I always think that's amazing.
Maybe you got allergies.
Yeah,
I
maybe
know,
bugs.
Jared.
Yeah.
But probably no helmet.
Yeah.
No helmet.
helmet.
No.
Yeah.
So, again, personal choice.
Personal choice.
I don't know why you guys are picking on me.
His name was Rusty Baker.
Yeah, maybe he realized when it was mandated that it helped with the bugs,
Yeah,
and he
could
just
be.
left it on. I don't know.
My favorite is the single individual in the car with the windows rolled up and a mask on.
Again, personal choice, right?
My favorite.
Personal choice.
All right, so, my report, I'm happy to say that our I should knock on wood when I say this, but our TB and latent TB patients are kind of quiet right now. So that's a good thing. We haven't really had any new ones come up, which is great. Watching all of our numbers. My class this semester was that practicum project on sexually transmitted infections. I made a brochure for patients for better communication and hopefully better referral system, and I made a handout for providers. So I actually brought some copies, but I talked to the professor yesterday, and I have a presentation tomorrow, and he asked to wait until after the presentation for some reason. So I'll bring those next month to our meeting, and they'll need some work. I would like the nursing staff and the clinical staff to kind of look them over as well. And then I also made a list of risk factors and social determinants of health, so that we're more aware of who to screen. And we're looking at some asymptomatic screening programs too. So even if you come in with no symptoms, you might get screened if we discuss that with you and you give us your permission. So lots going on there. And then talking about water systems, my education piece this month was on Legionnaire's disease. So I was working on it at the beginning of August because summer and early fall are kind of times for Legionnaires. And then MDHHS also put out a press release on August 14th on Legionnaires. So as you probably know, it's a type of pneumonia caused by inhaling bacteria called Legionella. And we usually find it in freshwater environments. So we've heard of like hospital situations, nursing home situations where it's in the water supply, and then people breathe that in. So You can get all sorts of symptoms, mostly pneumonia. That's how we diagnose it. So we'll do a chest x-ray. And you can get, obviously, shortness of breath, muscle aches, a headache, all those things that bacterial infections might give you. And let's see, there were 10,000 cases reported in the U.S. in 2018, but those numbers are also really distorted because a lot of us can walk around with Legionnaire's disease and not know. So if we don't have some risk factors, like being over 50, smoking, having chronic pulmonary disease, then we might be walking around with Legionnaires and not know that at all. So it is treatable with antibiotics. So one question when you have pneumonia in a patient also is, have you been in a hot tub recently? Because it can stay, the bacteria can live in hot tub situations as well. So we look for that certainly at times of the year again where we look for algal blooms when it's warm and water's kind of sitting stagnant. So can be obviously a huge issue if it runs rampant in a hospital, water supply system, air conditioning system, a nursing home where we're exposing lots of, people with immune deficiencies. So nice part is our area, let's see, in 2019 we had 5 cases in our Tri-County area. 2020 we had 5, 2021 we had 5, and 2022 we only had 1 case. So that's a good thing. Right now we have 3 cases. 1 is still under investigation. So when those come up, they go to MDHHS and everybody starts investigating, looking where the patient lives, making sure there's no exposure for other people. So
It looks like they've all been in St. Joe County.
a lot of them have been in St. Joe County. They have, unfortunately.
Just,
Yes.
We have nice, warm, large
Nice-
bodies of water.
Nice warm,
that
large
people like to
bodies
visit.
of water. So, so MDHHS put out a press release that pretty much has all the risk factors and things to avoid and things to look for. So, and how to check your water system. So people, there are some mandates for large facilities checking the temperature of their water. That's the big factor. And then kind of residual of the disinfectants that they put in there. So you don't really check for the bacteria unless you have a case. But if you're doing the temperature checks and the residual disinfectant checks, then that should be sufficient to not have Legionnaire and Legionella bacteria in your water supply.
If I could interject just one thing.
Sure.
And it relates to that. So, one of the real risk factors for Legionella in these large water supply systems is they have dead ends. So that's something we had a case, what's the name of the facility out there by 3 Rivers?
It's one of our long-term care
Yeah,
facilities.
one along. Anyway, they had a lot of lines within their water system that were just cut off, dead-ended, and rerouted, and that's a really bad thing for, actually it's a really good thing for bacteria to grow, because they're not getting any flow through there. So that's one of the things that when investigations are done, and these, is look for these dead-end areas, because that's where the bacteria can grow and multiply. So it's really important that the people that are running these facilities try to avoid dead-end lines on their water supply system.
Apparently lead doesn't kill Legionnaires, huh?
Yeah.
That'd be nice, right?
Apparently.
No, too bad you couldn't get some benefit out of it.
Yeah. Yeah, we have had also some patients showing up for lead testing. So normally we clearly test babies, but we've had some adults showing up for lead testing. They probably haven't had enough exposure time, I don't know. I mean, if that amount of lead. So we've actually been writing some lab slips. So if adults come in from 3 Rivers and they want to be tested, we are testing them and then I will take those results and kind of look those over and help with referrals if need be. So I don't think we're gonna get anything out of the norm, but I felt like people were nervous. I didn't wanna open Pandora's box, but several people came in and asked, and Amy called me and I was like, let's just test them and then we'll do what we need to with those results. So just to be a little bit more, make the community a little bit more comfortable and have that in their, be able to be tested if they wanted, so.
Any questions for Dr. Lucarello? All right, if not, we'll move ahead into department reports. I don't see Ms. Nichols here this morning, so does that mean?
No. She's on vacation, so I'm not gonna read her report, but I have one piece of news that I wanted to share. And that is with our Children's Special Health Care Services program. We did hear yesterday that they are going to expand to age 26. So, that is really great for those young people who are, still young enough to be on their parents' insurance and, need a little bit more care as they age out of that program. So at this point, that's really all we know. There is an expectation for some additional funding, but of course that will also mean additional work for our nursing staff. But that's really good news for those kiddos that need that support and those families. Other than that, is there anything on Callie's report that you wanted us to touch on today?
Right there underneath that, you had the last line there, reviewing applicants for the part-time hearing and vision technicians.
Yep.
Where are we at on staffing on that? Hillsdale County Schools started this week. I don't know when
Yeah.
the other two counties are starting, but they are back in school.
I think all three counties are back to
St.
school
Joseph's.
now. So Emily, who was our part-time, who took our full-time position that happened as a result of her retirement, is actually still gonna be staged out of the Hillsdale office. She's already, has appointments and is already working. So that part-time position, we have not filled it. We are going to continue to look for that person. In the meantime, we have one of our CSHCS clerical staff that also is trained and can do hearing and vision screening. So she will help take up the slack as we get somebody in place.
Yeah, so we did offer that job to someone, they accepted the offer and then backed out before their first day. So we had to start over.
We did hire the clerk for this office, right?
Yeah.
We did that. Trying to think if we've got any other, can't think of any at the moment. Paul has a position open in type 2 water. That one will be here in this office, right?
Yes. Well, it could potentially be in the Hillsdale office too.
Yeah.
One of the two. And we have one position in the Three Rivers office, so to cover all three counties, either here or even Hillsdale, depending on, where that person is from and where they want to live. We could be a little bit flexible on that.
And they're still in the process of interviewing for breastfeeding peer counselor here.
All right. But if you know somebody that has some talent with regards to water, we're looking.
Absolutely.
Okay, well, we will move on and go right into Mr. Andriotti's report on environmental health. I know we've already talked some environmental health.
Yeah,
this morning.
we've talked a lot, so I'm not gonna rehash any of that, other, just as far as the filter distribution, just to give you an idea of the numbers. We have, to this date, there's been a little over 700 filters distributed, between our office and the city office, so, things have slowed down quite a bit now, but, we've gotten a lot of filters out there, so, it's been a good thing. People have been very appreciative of being able to get the filters, and, so I think it's been, a positive thing for the health department to be involved with this and helping the city out. I know the city's appreciative of us helping, especially with the messaging, as Becky said. It's really important that the people understand the message and the importance of getting lead out of the water. So, I won't go any more on that. We did do our inspections at the Branch County Fair earlier this month. That went really well. This is I believe the third year now that we have taken over that enterprise. Typically, MDART has done all the inspections at the county fairs historically. A few years back, they had reached out to the local health departments with a pilot program to see if anybody wanted to do those inspections. We did opt in for Branch County. We did not opt in for St. Joe and Hillsdale. Those are back-to-back fairs, and it would really put a stress on our staff to try to do those as well. But we have taken over the Branch County Fair, and that has gone really well. I wanted to also update you on white pigeon PFAS situation. So I've been reporting on that for quite a long time now. The village was able to secure a grant for some money to do improvements on infrastructure within the city village water system, as well as to extend their water system out into the township and the area where the PFAS contamination is. So they have an engineering firm that is working on that. The caveat to this is the people have to want it. So 50% of the people that are part of that water expansion have to agree, yeah, we want this. And so there's a couple things to consider there. Not everybody that is affected by this extension of water has issues with PFAS in their well. Not everybody does. There's quite a few. There's about 30 or so that do, but not everybody does. The other thing is these people are not used to having a water bill, and this isn't a real high income area, so for some people to have another bill that they're going to have to pay, that's a consideration for them. They're going to be working really hard to convince people to hook to this system, because it's a long-term solution. I mean, right now they're getting the PFAS removed from their water through filters. As we all know, that's not a long-term fix, and filters do a pretty good job, but we certainly would like to have a permanent solution to that problem down there. So I suspect that there's going to be some pushback from some of the residents. Number one, because they don't want to have a water bill. Number two, they're going to want to keep their old well because they want to do irrigation in their garden stuff. They're not going to be able to do that. If they hook up to the municipal system, they're going to have that well disconnected. So one of the things that's part of this whole project is it's a one-time offer. So if they get 50% of the people to agree that they want this, they go ahead with the project. All the connections to the water system will be paid. The homeowners won't have to pay anything. But if they decide to opt out of it, and down the future say, maybe I should have done that, they're going to have to pay for it. The homeowners will have to pay for it. So that's another consideration. So I'm really hopeful that this project can go forward and they can extend the water system down there, and we can get a permanent solution for those folks that are relying on filters right now for filtering out the PFAS in the water supplies.
How do they gauge whether or not 51% of people want it? Do they do an election? Some kind of special election?
I think it's.
They have a list of homes,
Yeah.
and then they send out a mailer,
Yes.
and then they respond, so.
Yeah.
Through a mailer?
Mhm.
Yeah.
Right, through a commitment letter or whatever that they're gonna.
Right.
That they would connect to the service if it was installed.
They have to sign something then?
Yes. Yes. So I will keep you posted on that. They just started work on that. Becky and I had a meeting with the engineers that are working on that project here recently, and so we'll keep you posted. As long as we're talking about PFAS, we concluded our long-term monitoring for Eagle beginning of this month as well. One of those projects was around the Lucas landfill PFAS site, and happy to report we just got those results back, and they were all negative. So they tested for PFAS and for 1,4-dioxane, which was one of the compounds that was found in one of the original sites there. So all of the sampling that we did came back negative, so that's a really good thing. Let's see, what else do we have here? Okay, our new software system, Becky talked about that a little bit. So we went live last week, and we've had a few bumps. It's like any new software system. It's going to take our folks a little bit to get used to it, and we're still working out some of the bumps. We were really on a fast track to get this system installed, so it was fast for us, fast for for Hedgehog as well. They usually take longer than that, but we had a deadline because when our contract ended with Health Space. So things were moved along pretty fast, pretty aggressively, but I think for the most part things have gone really well. My staff is working through those, and unfortunately at the beginning, working with this new thing, with the new program, it does slow people down just a little bit as far as getting out permits and things like that, so there's gonna be a little bit of, a backlog maybe from that, just because just not used to it yet, but that'll be short-lived, and people will get used to this, you know. I think after a good solid month of using the software, people will be back up to speed on things, but I'm very pleased with the new software. It's got some great advantages to it. It really gives me a lot of tools for tracking basically all my staff. You know, what are they working on? Are they have any items that are have been on backlog for a while? You know, I'd really be able to track, you know, with the food inspections. I can pull up anybody's dashboard and see what inspections they have to do this month, what if they have any that are backlogged that they didn't get done from the previous month. So that's some really, really good tools for the administrative side for me, so I'm really excited about that. So we will continue to work with that. We talked about the algal blooms already, so I don't think I need to talk about that either. I think that's about all I have for today. I'll be happy to answer any questions that anybody might have.
Any questions for Paul?
Mr. Chairman,
Yes, Commissioner Matt.
thank you for all the reports you have submitted to us to read and digest. My question is, do you visit marijuana centers, marijuana shops, because they sell, I understand, edibles?
I'm
Edible marijuana, we
Oh,
don't have
no,
any
we do not get them. That's MDARD, Michigan Department of Agricultural and Rural Development, because that's
It's a state
retail.
licensing.
That's retail sales. We don't deal with retail sales, so that's regulated by MDARD. And I'm glad we don't have to deal with that, to be honest with you, Commissioner.
Thank you.
Any other questions? All right, hearing none, we'll move on to the area agency on aging.
Good morning.
Ms. Sutter and
And
the
Ashley.
ACLS Bureau, Ashley.
Yep, Ashley joined us today. I'm glad that you made it down safe. We had storms over here. Did you have
We had
storms? too?
storms and then the detour of the bridge threw me off, so I apologize for being
Good,
late
good
today.
fun.
Sorry, the chairman was late.
I wasn't late.
Same bridge he took.
So I did have a couple of enclosures. The one was informational that our area plan grant budget was submitted and reviewed and meets all the criteria for acceptance by the Bureau. So we're good there. Next year's allocations went before finance, so that'll be that's on the agenda later today, this morning. My first update is related to the next year. Next year is on our minds, so we're planning and writing grant proposals and resubmitting budget information to the Division of Victim Services for next year's Services to Victims of Elder Abuse grant. That's been submitted. They just gave us some feedback. A few tweaks are needed in the budget, which upload position descriptions, very simple fixes. So we're in good shape there. I did highlight a few of the focus areas. As you may recall from previous reports, our interdisciplinary teams are very, they hold and give us really good information about what's hitting our communities and what we might want to focus on in some of our outreach, education, building better teams. And so, housing issues that we've talked about, gaps in services, and then the community collaboration were our three sort of biggest priorities and focus areas in our narrative for next year. So wanted the board to be aware of that. Other highlights include, that's kind of a blurry picture, sorry it's a little pixelated, but that's one of our victim specialists, Wendy, at the Branch County Fair earlier in the month. Working on Veterans Day, working on Seniors Day, we had great conversations and have really, to me, simplified our table. So that's really nice to have much less clutter so that it can be targeted conversations with folks when they visit us. So we hope you'll come and join us at the St. Joseph County Fair. We'll be there on both Seniors Day and Veterans Day. It's always a good event. And provider assessments. We just finished our last one last Friday, so that summary of the assessment results will be before you next month for your information. There were no issues raised with this purchase of service vendor, so we're in good shape, and our providers are doing a great job. I think that's those are the only items I wanted to share with you today. Any questions?
Membership on the advisory council, how are we doing that? I don't think that's full yet, right?
No, we still have older adults and advocates that are needed in both counties. So we continue to talk about it at every meeting and are certainly promoting it on our website. The form is available on the website, and we'll keep our eyes and ears open.
Okay. While she's here, does Ashley have anything for us from the state?
I just have a couple of things. One, we came on site and completed our assessment, our yearly assessment of the AAA on July 18th. Happy to report there are no findings. You and your team do a great job, as usual. There is a letter saying that it was a great assessment. However, it's kind of going through the chain of command for approvals, not approvals, signatures, and some vacations kind of held that up. So the letter is still coming. I drafted it a while back, but it just needs some final signatures. This month, sorry, I was on vacation too so I don't even know what day it is. Last Friday, 8 AAAs presented their area plans to the commission. All were approved. The commission had some really great questions. We'll take the Region 3Cs and Region 2 will present in September. I think it's September 15th. We'll present our area plan. Or your area plan, sorry. It's not I can't take credit for that. And the only other information, Laura McMurtry, who some of you may recognize the name, she's been a field representative for, probably 20 years now, is retiring in October. So there may be a little bit of shifting for regions as far as the field representative. I don't know that for sure. I'm hoping mine don't change, but there is potential for a little bit of shifting. So I will keep you apprised of that. That is all I have.
Okay, thank you, Ashley. Health, education, and promotion. I don't see Alex here today.
Who's also on vacation. Yep, I know. He's on vacation as well, lucky dog.
I'm not sure. What is that word?
Lucky dog, aren't you leaving on vacation here in a couple hours?
I am. I'll be joining them, no, not joining them, but joining them on the vacation plan, but.
It'd be nice to have time off.
Yeah, well, they work hard and they're due. So, really, he just gives you some updates on medical marijuana. The graphic will be displayed on one of the St. Joseph County transportation vehicles here soon. So they did work that out. That's exciting to have that done. Our community health worker is still working with individuals and getting out at summer events to promote the agency and her services, so that's good. And the grant is extended through May of 2024, so we are very excited to have her on board at least through May of 2024. And lots going on. He talks about some of the other things they're doing. Social media is kind of headed up by Bella now. Josh is there to support. Lots going on.
Okay. Number 6A, approval of payments for July 2023. Those are in our packet. Tricia, do you have anything to say on those?
Yeah, I just wanted to point out that you will, on the last page of the bills there, which, is page 33, you'll see TSI Incorporated for the 21,000. That is the fit testing equipment that the board approved, so that's what that is. And then you'll also see just below that is Truckee Motorsports, and that's the ad for the Beta bus. So other than that, pretty standard stuff.
Is that one bus, Teresa?
Yes, I believe it is.
4,100?
Wrapping the whole bus, I'm assuming.
We're talking about that, just estimated costs on what that would look like.
I'll make a motion, we pay our bills.
Second?
A motion by Commissioner Baker, second by Commissioner Hoffmaster to approve the payments for the month of July. Any other discussion? Commissioner Matthew.
Thank you, Mr. Chairman. Page 32, line about 6 or 8 over that, and the bottom, Rose City, Schultz, Jopiak, and Bushire or whatever, $1,200. What is that?
That's the agency's attorney, so that would be attorney fees for things that we contact our attorney about.
Every month or quarterly?
I believe that bill was for, let me see if I
I'm having a bill quarter.
I would guess they bill monthly because we don't pay
Retainer.
we don't pay a retainer fee.
It is generally monthly, but I'm not sure the dates on that particular bill. I would have to look it up in the system.
Mr. Chairman?
Yeah.
Next month, next meeting, Ms. Fisher can report to us what they, thank you. No problem.
Any other questions? Hearing none, those in favor of approving the July 2023 payments as presented, say aye.
Aye.
All those opposed, motion carries. Moving forward, the review of the month-end financials. And again, this is in the packet. Ms. Fisher.
Yeah, so you will see the balance sheet, and then as you move through the packet, you have your expenses by program. And the agency is currently 16.49% under budget. This is not totally unexpected, because if you look toward the bottom of that sheet there, you'll see there are some large dollar grants that have only had very little bit spent out of them. For example, 355 COVID Public Health Workforce Supplemental, we've only spent 19% of that grant because, there's a lot of restrictions on that grant money, and when we pitch an idea to them, we've been having a very difficult time getting them to approve anything. And that is happening across the state. This grant has been a big problem across the state with getting approvals because the restrictions on it are so narrow. And then your other big COVID grant, 363, we've only spent 34% of that. So a lot of this unspent money is COVID grants that we're just not doing a lot of work in that program anymore. And so it is hard to spend that money. So we continue to monitor the budget as we, wind down the fiscal year and determine if there is some money that can be spent or not. I do believe at this point we are going to be able to put the money aside for the Hillsdale elevator out of this year's fiscal budget. So I do think that we're gonna have enough to take care of that. It probably won't be spent in this fiscal year, but it'll be encumbered for this fiscal year out of the dollars that we have unspent from some of these programs. So I'll be happy to answer any questions that you have.
You had, state owes us $229,000, when's that expected?
Yeah, so the state, if you're talking about the due from state,
Right.
that's actually money we owe them because they
Oh.
overpaid us.
Oh, okay.
What happens is these COVID grants, so most of our grants, we submit a quarterly report to them, and then they pay us off of that quarterly report. The COVID grants, they've said, okay, your grant is this amount of money, and we're gonna send you 1/12 of that every month throughout the fiscal year, and we're not spending it, which you'll see in your COVID responses. So we are getting overpaid, and we'll have to return that money.
I will entertain a motion to accept the financial statements for the end of July as presented.
So moved.
Second.
Motion by Commissioner Hoffmaster, seconded by Commissioner Baker to approve the month-end financials. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. All right, committee report, Finance Committee. Commissioner Hoffmaster, chair of that committee.
Yeah, we met Monday, had a productive meeting, everybody was present. We talked about a couple of the new business items that you'll see on the agenda, C, D, and E. We can talk more about that when they come up.
And minutes of the Finance Committee meeting are in the packet. I will entertain a motion to approve those.
Thank you, Mr. Chairman. I make a motion to accept the program policy appeals committees.
No.
Right.
Finance Committee.
Finance.
You're approving my
I
meeting, buddy.
apologize.
Well, approve finance, go ahead.
I second that motion.
Motion by Commissioner Matthews, seconded by Commissioner Hoffmaster to approve the Finance Committee meeting minutes as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Now, Commissioner Matthew, if you would give us a report on the Program Policy and Appeals Committee meeting from the 16th and the minutes that are included.
Thank you, Mr. Chairman. I want to, first of all, thank Commissioner Baker and Chairman Leininger for working very hard on the approval of the August 16 meeting in reference to the personnel policy, pages 17, 18, and pages 41 to 46. Therefore, I make a motion to approve the Program Policy and Appeals Committee's report fully.
Can we let Mr. House,
No, me on this one? I'll support Tom.
Thank you.
Yeah.
Motion by Commissioner Hoffman, or by Commissioner Matthews, seconded by Commissioner House to approve the Program Policy and Appeals Committee minutes from August 16th. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. All right, we will move on down into new business. And the first one there is the Personnel Policy Manual Updates. That is presented in our packet. As you just heard from Commissioner Matthews, those were discussed at the Program Policy and Appeals Committee meeting. So I will entertain a motion to approve that updated Personnel Policy Manual as provided.
Mr. Chairman, I make a motion to approve the Personnel Policy Manual updates. Especially I have indicated the pages 17, 18, and pages 41 to 46, and so on. Thank you.
A second.
And a motion by Commissioner Matthews, second by Commissioner Baker to approve the Personnel Policy Manual updates as presented. Any discussion?
Tom, did you find anything that we really need to look at, or does everything look okay?
Commissioner House, thank you. I believe thoroughly Commissioner Baker and Chairman Leininger, along with the Health Officer, Ms. Burns, and the Director of Finance and Personnel, Ms. Fisher, we really worked on it, and I have looked at, and you can take my word on. If I am mistaken, we can amend later on.
You're good, I'm good.
Yes, thank you, Commissioner.
Just an item of note, and we discussed this at our meeting, the way this is presented, it shows what the language was. That's in red and with a line through it. It shows what the new language will be. If you go back to the table of contents, you'll notice that some of those page numbers show changed on the table of contents, but when the language is actually updated and changed, those page numbers may not change, or, they may actually go down as opposed to going up. Just the way it's written up, it's supposed to see all those changes. So just with the understanding that those page numbers that we see here may not be what's in the final personnel policy.
Good
Any other discussion?
I only see a couple of changes in the whole thing. right?
Oh, there's several
No,
back
that's
in there,
right.
if you get
Okay.
back to,
Page 42.
Okay,
if you get, yeah, like page 40,
We had to buy more ready.
in the 40s.
ready.
There's a whole page that's almost all red ink, there's, it's page 87 of the packet. so
There we go, there we go.
Any additional discussion? Hearing none, I will enter, of those in favor of the approving the changes to the personnel policy manual, say aye.
Aye.
Those opposed, motion carries. Next up is the health officer evaluation policy. Again, was discussed at the program policy and appeals committee meeting. I will entertain a motion to approve the updated policy as presented.
Mr. Chairman, I make a motion to accept the health officer evaluation policy as presented before us.
Support.
Any discussion on that policy? Mr. Massey?
Mr. Chairman, there is a line we have eliminated, that the amount we need to talk about.
The amount is included in the health officer's contract, and should Becky decide to move permanently to the UP and we have to find a new health officer, that new health officer's merit pay in their contract may not be the same, maybe a different figure than what had been shown in this, and so if we take it out, then we don't have to update that policy whenever we change the health officer's contract.
Makes sense.
Thank you.
And also included in there, and we reviewed these as well, are the questions for the health officer's evaluation. There were no suggested changes to those. And again, as I mentioned earlier, after our meeting today and the next week or so, I'm gonna guess, we will all be receiving an email from Teresa with those questions in a digital format so we can complete that health officer's evaluation.
If I may add, Mr. Chairman,
Yes.
the employees also will be addressing that issue. correct?
They have already done their staff survey, and we'll be getting a copy of that so that we can have that knowledge when we complete our evaluation. Any further discussion on that health officer evaluation policy? Hearing none, all those in favor of?
I'm sorry, if I could interject, I did not, get who seconded that motion.
I did.
Thank you.
Yep.
Okay.
All right, all those in favor say aye.
Aye.
All those opposed, motion carried. Moving forward, letter C, the Area Agency on Aging fiscal year 23-24 provider allocations. And I do believe these were discussed at the Finance Committee meeting, so Commissioner Hoffmaster.
We had Miss Laura talk to us about the provider allocations. She did a great job. I'm sure she's gonna do a wonderful job today.
So we used a couple of pieces of Bureau-issued estimates for our targets for the funding that we're anticipating for next fiscal year. Those are incorporated in the proposed 23-24 column. We tried to keep everybody right around the same level as they were or at this, the way that we started this fiscal year. There are no anticipated American Rescue Plan Act funds incorporated at this time, nor are there any other special project funds that are incorporated at this time. The state budget bill did include a couple of new projects, but those dollars have not been run through the funding formula, nor have the rules been promulgated as a result of the legislative process. So we don't have much to go on at this point. So this is just our base funding for all of the services that are authorized under our current 3-year multi-year plan. It follows the allocation strategy that we followed for the bidding out of the contracts and the services. So there's nothing major that's changing. There is a little bit of additional home delivered meals funding that the state was anticipating, so that is planned for and incorporated here. We've also incorporated the providers' feedback. That's always a big part, to see how their current grants are running, where they may or may not want to shift things for next year to address the demand for services. And so all of that provider feedback is also included in the proposed 23-24 column as well. Does anyone have any questions?
Commissioner Matthews?
Thank you, Mr. Chairman. First of all, I want to thank our Finance Board and also Director Sutter for adding approximately $11,000 more for our home delivered meals. I know we have a sufficient funds from the millage. However, it's a good news is that it is a growing prospects. In other words, we are serving more people, citizens in delivered meals, and we want to thank our Finance Committee for that. Thank you.
Do we have a motion to accept the provider allocation?
So moved.
Second.
We have a motion by Commissioner Hoffmaster, second by Commissioner Lenius to approve the provider cost allocations. Any other discussion? The only two questions that I have is you see the increase in the home delivered meals for both counties. Branch County, I think, also has an increase in the congregate meal. St. Joe County is about a $10,000 decrease in congregate meals. And also their personal care figure is cut in half, but home care or house making is increased. Is that kind of?
That's based on provider input, yes. There are flexibilities that we have with some of our state and federal sources in which they can target and give us feedback on how and where they would want those dollars. And that providers in St. Joseph County Commission on Aging Director gave us feedback, so.
Okay.
And it's not a problem for us, but we want to be responsive to what the program needs are there, and if we can shift, we'll shift.
All right. Any further discussion? Hearing none, those in favor of approving the provider allocations as presented, say aye.
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 All those opposed, motion carries. Next up is the cost allocation plan. Again, this is coming from Finance Committee, so we will turn it over to Commissioner Hoffmaster.
Director Burns, would you like to go over this with us, please?
Well, I would love to, but I would love to also allow Teresa the opportunity to share with you that, you know, this just tells us how we spend our money, outlines what we need to do, and it puts it into compliance with what currently we're doing. And what else would you say?
Yeah, so, you know, the grants have certain requirements on how we track and what we track and how we charge each program. So when an expense gets incurred, how do we charge that and which grants get charged? This spells out in detail on what we charge to who and what grant gets charged, and keeps us in compliance with audit and grant dollar requirements. So.
And we'd like to note that we don't have to count every piece of paper to the copier anymore. That's a neat thing that we don't do.
My staff is very happy that they don't have to do that anymore.
I'm surprised you remember.
You know, that'd be
I picked up a lot of stuff.
Yeah.
I will entertain a motion to accept the cost allocation plan as presented.
So moved.
I second.
Motion by Commissioner Hoffmaster, second by Commissioner Matthew to accept the cost allocation plan as presented. Any further discussion? Hearing none, those in favor say aye.
Aye.
Those opposed, the same. Motion carries. Final new business item is the Board of Health meeting schedule change, and that was presented, and I do believe the thing that I'm seeing there is the change the time of the finance committee meeting to 9 a.m.
I can take this one, Chair.
Go ahead.
Commissioner Lanius asked if we could adjust those meetings. Everybody on the finance committee agreed that that would be fine with our schedules. Staff felt like that was fine. It would just line up better for our schedules. So we're hoping that the full board would approve the new meeting time, which same day, just instead of meeting at 11 o'clock, we'll meet at 9 a.m. here.
And I would like to add that Commissioner Matthews responded how well we work together as a team in finance. So we are a very fine-tuned running machine, and 9 a.m. would work better on our schedule.
That doesn't interfere with the pickleball.
That's what I
It
said.
does,
That's my first
it
question.
does. I'm gonna adjust my game, but
my first
for
question.
the brotherhood of our finance team, I'm gonna sacrifice.
We appreciate that sacrifice.
We certainly do.
Thank
Being
you.
on the policy program appeal, I don't have a dog in the fight, so whatever you wanna do.
All right.
Therefore, Mr. Chairman, I second that motion if nobody has done.
Well, I wasn't sure who made the motion yet, but.
Me neither.
Hoffmeister makes the motion.
Thank you.
Matthew can second.
Matthew, second motion to accept the updated Board of Health meeting schedule as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries.
Everyone appreciate that.
I wish I could get a few of my other boards to go this time, but,
Well, maybe to get him on here before.
Yeah.
Gee, thanks.
we are now back to that time on our agenda where the public can address the Board of Health. We do have rules, and no speaker is allowed more than 3 minutes. No public comment. I will entertain a motion to adjourn.
Make a motion to adjourn.
Second.
Motion by Commissioner Baker, second by Commissioner Lanius to adjourn. All those in favor say aye.
Aye.
All those opposed, motion carries.